its revised health care bill. Senators are hoping that this one can get more support from senators who were before on the fence. But we have contained limited coverage policies that's going to put money aside to help fight the opioid epidemic. Still, it may struggle for the GOP to get those 50 votes that it needs to get it passed. So joining us this morning, the director of JU's public policy analysis and political analysis, Rick Mullaney. Thank you so much for coming on our show. This is such a messy topic. It's kind of confusing for people. So we want to first start off by talking about the changes. What are the differences here that they've made for this health care plan?
Well, let's put this in context. This is a Senate bill, and it's a revised Senate bill, one that Senator McConnell pulled a few weeks ago because he didn't have the votes. And what you really have here is a battle between the conservative wing of the Republican Party and the more moderate wing. And so some of the changes include an amendment from Ted Cruz, and this is really to address the more conservative side. What he'd really like to do is to sell insurance policies that aren't as heavily regulated. In effect, cheaper insurance for many people who would prefer cheaper insurance that doesn't have mandated coverage provisions. That sounds good and is helpful in a number of ways, but it also has a consequence. It has a consequence for those with pre-existing conditions and maybe increased costs for older Americans. And that's why this bill also contains some subsidies to help address them. So one of the big changes is the Ted Cruz amendment. Another big change from the prior bill is the retention of two major tax provisions. One is a 3.8% tax on investment income, another is about a 1% tax on payroll tax. That is on higher income individuals. That money is generated to help soften the reduction in coverage in some areas. So what you have is a battle on the conservative side, and on the more moderate side, it's going to come to a head this week. Very, very close, very, very difficult. It hangs in the balance.
What do you think? Do you think it's going to pass?
Well, Mitch McConnell is a magician, and this will test all his skills as a magician. First, they have to have a procedural vote on whether to go forward with the debate and the vote itself. Then it would come to a vote. Right now, it's in serious trouble. Already, two senators have come out and said they're going to vote against the procedural vote to even have the debate. Remember, they don't have much of a margin. If they lose one more, it's going to fail. So if you were a betting person, this is one I'd recommend you not bet on. It's too close to call. I will say this, it's historic. The Affordable Care Act was passed in 2010, implemented in 2013. Over the last 7 years, you have seen the Republican Party, this has been central to them, in arguing for the repealing and replacing of Obamacare. This week it comes to a head. Very difficult to see if it passes or not.
I was going to say, how does this reflect on the Republican Party right now, especially if it does not pass?
I think they're in a very, very difficult position politically. If it doesn't pass, like I mentioned, for the last 7 years, the Republican Party has been talking about repealing and replacing Obamacare. And President Trump, this was a big part of his platform in running for the presidency, to repeal and replace Obamacare. In addition, repealing and replacing Obamacare is a big part as a predicate for tax reform that is next on the agenda for Republicans. So if it doesn't pass, it is a major setback for President Trump and for the Republican Party. And as I've often said, however, from a political standpoint, the only thing worse may be passing it. Because if you pass it, then you own it. And if you own it, just as President Clinton found out and as President Obama found out, they got really hurt in the midterm elections when they owned health care. Republicans could be in a very difficult position come November 2018 if they own this with its reduced coverage.
It seems like no matter who's president, what changes are made, nobody is completely satisfied with health care. I mean, we've seen it every time.
In the end, we aren't going to satisfy everybody with health care. Let's face it, very simplistically, there's cost, there's quality, and there's access. And you simply can't have all three. And that's why whenever you see a tweak to the legislation that helps in one area, it tends to hurt in the other. Ted Cruz may offer an amendment that lowers costs in one way, but it may affect coverage over here. You do something to increase coverage over here, and it can affect cost. If you're Senator Portman from Ohio and you're concerned about Medicaid expansion, this change is of concern because you're going to get a reduction in that expansion. So, and if you're a free marketer and you want to go more to the market-based system to drive down costs and lower premiums, you may have an effect on coverage. So, very difficult, very challenging, and you're not going to satisfy everybody.
Well, we'll have to see how it goes this week. Of course, if you need to stay up to date with the latest on the healthcare topic as well as politics in general, go to newsforjax.com. You'll also find this interview there if you want to share it. It's going to be posted on the morning show page later this morning.